Hello, this is Dr. Thomas Dobbs, and welcome to a 3-minute COVID update on January 13th, 2022. We want to talk a little bit about what's going on with COVID. You can see over the past few weeks with the Omicron wave, we've had a phenomenal number of cases. We have registered over 34,000 cases within a week, but fortunately, we haven't seen the same proportion of deaths that we've seen with previous waves. Fortunately, we know that Omicron seems to cause a less severe illness, in part because of the intrinsic characteristics of the virus, but also because we have a far more immune population. If we look at what's going on with our cases and hospitalizations, although it does cause a less severe illness because of the remarkable number of cases we have, we are seeing a massive increase in the number of new hospitalizations, putting increasing strain upon our healthcare system and overloading our ICU systems. We do know that vaccines are still our best bet. If you look at being fully vaccinated versus boosted versus unvaccinated, you can see that the majority of deaths are still occurring in unvaccinated folks. And we know, especially for Omicron, that you really need to be boosted. You need that third dose to get the added effect, to get full protection. So please, if you haven't had your booster yet, get your booster. If we look at the protective qualities within the different age groups, you can see that if you're 40 to 49, there is an 8-fold risk reduction in death if you've been vaccinated. If you're 50 to 64, a 9-fold reduction. And if you're 65 and older, 8-fold risk reduction of death if you're vaccinated, and it's even better if you're boosted. What about treatments? If you want to get treated for COVID, we are using our COVID centers of excellence to make sure that people have access to treatments. This is found on our website, and if you Google MSTH COVID Centers of Excellence, you can find locations that will have some of these products available. What products are available? We have oral antivirals, which are really welcoming to have these now available to us. Paxlovid, which is very effective against preventing deaths or severe disease, about 90% effective. We've only gotten 1,220 doses, however. It is effective versus Omicron. Molnupiravir is another oral antiviral medication. We've received a little bit over 5,000. And again, it's effective versus Omicron, but only has a benefit of severe disease or mortality of about 30%, but still helpful. Monoclonal antibodies, which we've used quite a lot here in the state of Mississippi. This is the allocation we had for this week: 400 doses of bamlanivimab, etesivimab, 484 doses of REGEN-COV, and 438 of sotrovimab. Unfortunately, only sotrovimab of these is effective versus Omicron. BAM-ETI and REGEN-COV are not effective against Omicron. And this week, on our last report, we logged 100% of new cases are Omicron. So we will be recommending that clinicians and physicians do not use these products right now based on the distribution of Omicron versus Delta. We also have a monoclonal product called Evusheld, and we've had a total of 648 doses allocated to Mississippi, although none have been delivered yet. This is a preventive treatment for high-risk patients like cancer patients who are taking a chemotherapy or have severe immunosuppression, or transplant patients who would not respond to vaccines. And this is an infusion that gives you basically effective antibodies for about 6 months. We have distributed those, or will be distributing those, to our transplant center at UMC and also to comprehensive cancer centers around the state. Not enough, but we will try to get it to the highest risk folks who need it. We also have an intravenous antiviral called remdesivir. We've had this medication for a long time. It is previously approved for inpatient use. It's now been shown to be effective for outpatient use. It comes through the commercial distribution channel. It's a 3-day infusion, and it is effective against Omicron. There are some payer issues that are being worked out with the federal government and with insurance companies, but it is something that is going to be highly effective. Testing, if you need to get tested for coronavirus, we are trying to expand more and more availability of testing. At this recording, we still have 1,500 testing appointments open throughout the state. So go to covidschedule.umc.edu if you want to get tested. Go to your local clinic, go to your physician's office, go to pharmacies that have testing. We do strongly encourage you, unless you are ill and in an emergency situation, do not go to the emergency room. The emergency rooms are in fact overwhelmed. And many of the emergency rooms are also serving as adjunct intensive care units because we don't have enough beds. So please don't overload our emergency rooms just to get a test. If you're sick, of course, go to the emergency room if you need it, but don't go just to get the COVID test. Additionally, we will be getting some home tests that we'll start distributing to high-risk communities and disparity communities in coming weeks. We haven't received any of these yet, but stay tuned. That's something that the health department will be trying to release in the near future. Thank you.